Cruel and unjust statistic, according to the 2019 United States Census, about 26.1 million Americans were medically uninsured due to their inability to afford the payments required for health insurance. Despite this horror, today I have the great pleasure of introducing the solution to this massive problem. Golden Valley Health Center, a nonprofit organization committed to serving the underserved in our very own community here in California's Central Valley. Today, I will be sharing a little bit about Golden Valley Health Center's history, secondly, about their mission and values, and thirdly, about some of the services offered by the health centers. In 1972, originally known as Merced Family Health Centers, the nonprofit that would become known as Golden Valley Health Center was born and formed separately from the hospital to receive federal funding for migrant health. After receiving this funding, the nonprofit quickly opened more than 11 clinics throughout Central California, including not only family practice medical doctors, but dentists as well. GVHC began not only serving migrants, but those citizens who could not afford healthcare as well. This nonprofit renamed themselves to be inclusive of all those they served, coming up with Golden Valley Health Center. It became blatantly clear that with the demand at these few sites increasing so quickly, there must be many more people in the greater California area needing help. According to Reynolds and Fisher in their 2020 paper titled "The Role of the Medicaid Expansion in the Use of Preventive Health Care Services in California Men," the average American is paying a whopping $588 per month for basic health care. This monthly payment for a basic human right is completely unattainable for the average human. And current CEO Tony Weber recognizes that. He has earned accolades by being the employer of choice and has established 36 sites throughout the Central Valley with over 140,000 patients being served every year. Golden Valley's mission is clear, and that is to improve the health of our patients by providing quality primary health care services to people in the communities we serve, regardless of language, financial, or cultural barriers. According to the paper by VIA published in 2020 titled "Advanced Healthcare Directive Awareness," 15.1% of the population for whom poverty status is determined in Stanislaus County, California, live below the poverty line, a number that is higher than the national average of 12.3%. So many of our fellow peers are living in subpar conditions with inexcusably poor access to healthcare services. This is where Golden Valley Health Center steps in. Golden Valley Health Center has a vision to be recognized as a premier organization, ensuring access to high quality, culturally responsive, and comprehensive primary health care for all, especially the underserved. This vision is becoming more and more real because of you, our supporters and donors. As reported by the Data USA database in 2019, 47.6% of the people in Stanislaus County, California are Hispanic, 262,000 people, revealing just how great the injustice in our healthcare system really is. According to the U.S. Department of Health and Human Services Office of Minority Health, the Census Bureau reported that 50.1% of Hispanics had private insurance coverage, as compared to 74.7% for non-Hispanic whites. Because the Golden Valley houses such a large portion of these underserved communities, we must take action to stand by our constituents and provide healthcare for them and their families. You can help by donating or spreading the word on social media via our most recent post on Instagram, Twitter, and Facebook. Along with these options, you can also help Golden Valley Health Center by volunteering at our free clinics to get patients registered and signed in for their appointments. If you are interested, please come speak to me at some point tonight. Golden Valley Health Center offers medical care in the fields of family medicine, dentistry, pediatrics, women's health, chiropractics, podiatry, optometry, and behavioral health. All of the services provided are via elite board certified and licensed healthcare professionals. When it comes to payment and fees, Golden Valley offers those who do not have insurance coverage a sliding fee scale based on proof of income and last year's tax returns. By allowing this option, it is you, the donors, who help make this possible. Imagine your child is sick and needs medical care, but you cannot afford to take him to see the doctor for treatment. Put yourself in these parents' shoes. This is cruel and unjust, as a basic human right is not even being provided to everybody. It is inhumane and unfair to allow someone to suffer simply due to the fact that they didn't get lucky in the financial draw of life. Today, I have touched on Golden Valley Health Center's rich history, their mission, vision, and services provided at little to no cost. I want to thank you for listening to me speak today on behalf of Golden Valley Health Center, and I'm hopeful you continue to open your hearts for the members of our community who need our help. We stand as one, we stand together. Thank you.